Hello, everybody. Welcome back to the Iron Purpose podcast. I am currently on a work training up in Duluth, so we're recording this introduction in the little fitness area here. But today's episode is going to feature Dr. Alisha Lindberg. She's the one who helped bring Caden into this world, my son, and I couldn't be more excited for the conversation that we got to have. We got to talk about kind of the highest of highs and the lowest of lows in her profession and how it helps make her into the person that she believes that she's supposed to be. Being an OB helps her be a better mom, and being a really great mom helps her be a better OB. And the situations that she's gone through has helped make it so relatable for moms and for parents who are struggling within the whole process of pregnancy, delivery, and into the beginning stages of parenthood. Now, this conversation is going to look just a little bit different. It's just going to be me on the screen. It'll be like a phone call conversation, but you'll be able to hear her, you'll be able to hear the conversation, and I hope you enjoy it just as much as I did. Once again, thank you so much for tuning in to episode 25 of the Iron Purpose podcast featuring Dr. Alisha Lindberg. Stay sharp, everybody. Welcome back to the Iron Purpose podcast. I'm excited for this one today. I think I say that for all my episodes, but this one's a little special. Today with me, I have Dr. Alisha Lindberg, and she's actually the one who helped deliver my son, Caden. And when I told you about my podcast and about you, hey, come, want to come on? I'd like to pick your brain. I think at first you're kind of like, no, I don't want to be on that. And we were just kind of talking beforehand a little bit, like, even if we were never to post it, or even if like people didn't watch and tune into it, like I have so much fun talking with people about their passion and about their life. And this is almost like a form of journaling for me, being able to just speak my mind with somebody else and get their perspective on life and things that I'm able to learn is super cool. So I just want to start with thanking you very much for taking the time to come on here. I know you're a busy lady with kids and with work, being an OB, and a lot of responsibility that entails now being a parent. And having my wife have you in her corner, you have a lot of responsibility. So it's I really appreciate you taking the time to come on.
Of course, thanks for having me.
Yeah. So what you got going on now that the weather's getting nice? You been out getting to enjoy the weather at all?
Yeah, we live on a small lake, and so our pontoon is in the water, and that's something that my kids and I love to do all summer. So I have a 5 and a 2-year-old, and then my husband. So we spend a lot of time outside. So it's been really nice that the weather's getting better.
Do you guys do any fishing out there, or just kind of hang out on the pontoon?
Oh yeah, so both my daughters like to fish. My husband really likes to fish. I'm a medium amount. I like to mostly enjoy the water and sometimes read a book. So
yes, that's awesome. I guess I could share how we met. Courtney and I, we found out we were pregnant. I think it was about last June, or just like the early stages of June. We kind of found out that we were pregnant, and the whole journey of finding an OB, finding a doctor, what we want to do. And when we met you, you were one of the top ones that we were like, we really hope that you're available to deliver our baby, just with your personality and just the wealth of knowledge that you had. And we got to, kind of got to know you through that. And then obviously after the experience that we had during labor with Caden, just the energy that you brought, being a first time parent, you don't know what to expect at all. And we're going to get into that a little bit, the unpredictability of everything. And you just being in there, I think we had the perfect nurses at the perfect times. And then you coming in there, and we're just like, okay, well, there's, one nurse here. Okay, we're going to start pushing. It's like, well, where's all the doctors and chaos that you see on the TV shows? It's like, my wife isn't screaming. What do I do? And then you come in and you're like, all right, we ready to do this? Glove up or whatever. And just the energy that you brought to it was super cool. And it couldn't have gone better. I couldn't have gone better under the circumstances, in my opinion. So you being an OB, I think is perfect timing for our situation, for you being in there. Now I think I want to just kind of open up, give you the opportunity to kind of discuss maybe your life, kind of how you got from where you were to where you are now, because obviously you have a personality where it's more than just a profession to you, in my opinion, from what I see. And that's what I like to get out of guests that I have on here. I see they just have something about them that's like they there's there's more than just a paycheck, and
Hmm.
they really take their profession, and rather than being a doctor, you like the doctor is you kind of thing, if that makes sense, and you kind of make it your own
Yeah.
way, and it's super super cool. So take it away.
Yeah, that sounds good. That does really resonate with me. I do think that I'm where I'm meant to be, and I really do love my job, especially, meeting patients. And my favorite part of my job is kind of in your scenario where I get to meet a patient and see them throughout pregnancy and then be a part of the delivery. That continuity of care is ultimately the favorite part of my job. As far as kind of where I have been, I grew up in Minnesota. I did all of my training at various University of Minnesota locations. So I did undergrad at the University of Minnesota Morris. I did medical school in Duluth, and then I did the rest of my training in the Twin Cities. So kind of Minnesotan through and through.
Hmm.
Um, I didn't exactly know when I decided I wanted to become a doctor. I feel like um, it wasn't necessarily one big aha moment, but kind of a lot of little nudges along the way.
Hmm.
Um, and like there was a time in biology class in high school where I was like, this is awesome, this is really cool, I love learning the physiology. And then talking with different providers throughout just like my well child checks as a kid. And um, then once I got kind of deciding what I wanted to do, I was like, yeah, I mean, I want something that's not stagnant, that's constantly evolving, where I can learn. And kind of, I mean, medicine's constantly changing. So
Hmm.
I just I loved school growing up. That sounds kind of nerdy, but I I did. I loved school. I loved learning, and kind of understanding what was happening. And then kind of now, I graduated residency 3 years ago now, and kind of everything that's happened in my life up until today, I feel like there maybe was some fate or some divine intervention that led me here, because um, I don't know that I would have been able to kind of get through all of the medical trauma, honestly, that my family has gone through in the last 5 years without having like being in the medical field and understanding what was going on. I think that would have been a lot more challenging. So I think it was all kind of meant to be.
Hmm. Have you always? So when did you decide? So it was like later on in high school that you kind of decided you wanted to be a doctor, but you didn't really know OB. Or when did you decide?
Mhm.
I wanna deliver babies. Like, because
Yeah, yeah.
that's gotta be a big weight on your shoulders to a lot of pressure. What if things go wrong? What if things go right? And like I said, it's from my outside perspective looking in, like it's a lot of responsibility, and you seem to be just taking it head on and crushing it. But where did that inspiration come from to want to
Okay.
deliver babies and help
Yeah.
moms?
The way medical school is set up, the first 2 years of medical school are classroom, where it's kind of just like a traditional like biology class where you have different units that you learn, and then years 3 and 4 are the clinical rotations. And so there's a set of core clinical rotations that we do, and OB is one of them. And then I also did a rural longitudinal track my third year, something called RPAB, which stands for Rural Physicians Associates Program. So I knew I wanted to work with women and kids, mostly because I felt like I connected really well with female patients. Like I felt like a more of a connection there.
Mm-hmm.
And I do also really love working with kids. And so initially I was thinking, well, maybe family medicine with kind of an OB emphasis, where I could do deliveries and then also see women and children. Um, and then I had my OB rotation that third year. And it was incredible. It was the most fun I've ever had. The physicians I worked with were amazing. They loved their jobs. It was never the same day to day. Sometimes they were in the clinic, sometimes they were in the operating room, sometimes they were on labor and delivery, and then getting to be part of those birth experiences was just something so powerful and special that I was like, I think this is it. I think this is what I'm meant to be doing.
Mm-hmm.
Um, and then during that rural track that I did, a lot of times as a medical student, you don't get to participate in a lot of deliveries because generally there's different residents and different things on the OB rotations at like the big hospitals in the cities, where the medical students don't get to participate much. They're more observing. And so the rural track that I did, I actually, even as a medical student before I did residency, I was able to participate in like 40 some deliveries.
Oh
Um,
wow.
and Yeah, and I was on this rural track for 10 months. And so I was at a small hospital in Wisconsin, actually. And like some of the best parts were I would get to see these women who, are newly pregnant, and I would get to be part of their deliveries towards the end of my rotation there. So that longitudinal care, again, is like, it's so special.
That's awesome. Did it come naturally to you as maybe you can think back to the first delivery that you did solo, if I can call it that.
Hmm.
Was there a lot of nerves behind it? Were you like, what do I do? Or did that, obviously
Hmm.
your schooling and stuff helped prepare you for that. But when you walked in to help deliver Caden, like it was just like you were just riding a bike, like, or you were just going in to brush your teeth or something. So it seemed just so simple,
Yeah.
and it brought my anxiety
Yeah.
way down. And I can't speak for Courtney, but I'm sure it helped her so much too, to just be like, oh, okay, this person's cool. Like she's seen it, she's experienced, she's got it. Like it just is like, all right, yep, just another. You're literally pushing a child out of you, but hey, it's just another thing. Like,
It's
did
just
that kind of
another
come
thing.
naturally to you?
Yeah, and I that's funny because I've heard that from a couple other patients, especially for C-sections, surgical deliveries, because they're like, yeah, I walked into the OR and I was terrified, and everyone just looked like they were, about to serve me a cheeseburger or something. Everyone was so calm, and it's like, I'm like, yeah, that makes sense. Like we do this all the time. C-sections are one of the most common procedures in the U.S., and yeah, I've done a lot of births, and but definitely especially when I was a medical student, and even beginning residency, you definitely get those butterflies in your belly where you don't know what's going to happen, right? You don't know, is baby going to come out and the shoulders are going to get stuck? Is there going to be a quarter on baby's neck? Is the mom going to start bleeding profusely? Like there's all those kind of unknowns. And before, in the beginning of my training, when you're new to it and it's not something that you see all the time, it's quite terrifying. Pregnancy and childbirth are not for the faint of heart.
Mm-hmm. Yeah, and another quote just kind of came to mind as you were talking. Often we hear the term "fake it till you make it." Is that something
Mm,
that you've ever thought of or that you've kind of practiced? Because you, even when things weren't like things were going pretty good, and we're like, "Oh, the baby's gonna come out right away," and Courtney ends up pushing for 4 hours, dang near, or yeah,
mm-hmm,
a little bit longer, and even throughout that process, like you were still very confident in what you were saying and what you were doing and very calm about it, but you still brought like that honesty aspect to it as well. Like, hey, you're doing so good, but we might have to transition to a C-section here if it doesn't go this way. And like, does that come with experience as well? Just like that calmness of having to explain to a mom, like, hey, we might have to transition to something here. Because obviously you want to be able to continue that the upbeat, happy attitude, but when things change, like you got to be able to be honest with them, but also carry like that
mm-hmm.
confidence and like still like we're gonna be all right. Like, are there times where you have to like you're scared and you got to be like, okay, well, we got to still present this opportunity. We still got to present this issue, but still present it as in like we're still good. We're still gonna be confident, because I'm sure there's times your teeth might be chattering like, oh man, I don't know about this, but I can't show that to the mom because then it's gonna elevate her stress. The dad's gonna pass out, and then we're
Yeah.
gonna have a world of hurt. If that makes sense.
Yeah, I mean, I think there's part of that in every profession, honestly. But yeah, I mean, there's definitely times where I'm like, oh man, this is going to be really hard. And I think part of it is my experience as a mom. For my births, there were times, even as an OBGYN, that I was like, this is terrifying and scary. And I don't know, this is what I do for a living. And if I'm feeling this scared and terrified, like imagine a patient who doesn't have that background. And
Mm.
so I think part of it is when I work with patients, I value education for them so much, like explaining to you and Courtney that, it's not normal for someone to push, beyond 3 hours, but we have reassuring heart tones and things like that. And I think that letting the patients really drive the decision making makes everyone feel better, because giving you guys the opportunity to know what's going on, to know all the different avenues that we could go down, and to have some input really is what is comforting to patients, to know that it's not out of control, right? That they still have, obviously there's some things we can't control, if we need to do something emergently, but stressing out and being anxious and kind of freaking out doesn't really help anyone. It doesn't help the situation.
Right.
Like, so you got to kind of, well, just, and the other thing is that we're trained for those emergencies too. So, even in those scenarios where I'm like, oh man, this is, an emergency section, we're going downstairs, like doing a C-section, in residency, we do so many C-sections. We get trained to get the baby out in under a minute. So we can,
Wow.
from the time the mom is asleep to the time as the baby is out is less than 60 seconds.
Wow.
Um, and and you do so many of those in training that you feel confident in that. And even if it's been, a few weeks since I've done a C-section, it's like riding a bike. Like those
Mm-hmm.
skills, though, that rhythm is just kind of ingrained into you in training that you just it comes like riding a bike, like you said. Like it's just something that is part of you now.
Mm-hmm. Now, we kind of talked about training, and I'm glad you did, because there's a question that I had asked, and it was a quote that goes along the lines of, "You don't rise to the occasion; you fall to the level of your training." Now, I'm assuming, obviously, as an OB, as a doctor, there's continuing education to kind of stay sharp. But are there other things that
Hmm.
you do, maybe on a more like personal, out of work level, where you're trying to stay sharp, trying to make sure that you're on top of your game, so that when you go into work, you can perform at those levels?
Hmm. Yeah, I mean, there's definitely continuing education. There's multiple board exams that you have to take kind of throughout the process of becoming a doctor. And then once you graduate from residency, so you've been a doctor, you've worked in residency for 4 years as an OBGYN, and then you have a year or two in practice, and then you have to actually take an oral board exam, which I took last fall. And so, all of this you're still learning every day, right? Like medicine is not
Mm-hmm.
something where you've studied the whole textbook and now you're good to go. It's something that's always changing, and I think having that attitude of um, that things are constantly changing and evolving, and maybe I haven't seen this in a couple weeks and I need to go refresh, and that's okay, right? I would rather have a physician who is going to look up the recommendations and make sure that everything's up to date, rather than, oh yeah, when I was in residency 10 years ago, this is what we did, so this is what we're going to do now,
Right.
like. So I think staying up to date on all of that kind of stuff is one of the ways. And then the other thing is just I feel like I had a really good training experience. There's times when I'm operating in the OR and that I just hear there's certain attendings that you operate with in training that are, I don't even know how to describe them, kind of like a mentor almost, but they're like that to everyone. But they just pop in the back of your head like, okay, like first step of surgery, restore normal anatomy, like all these like little mantras almost that kind of just like pop into your subconscious when you're doing those difficult cases or difficult deliveries. Um, and so I do think that, one, training, and two is, yeah, staying up to date on things is super important. And
Mm-hmm.
I'm always happy to learn, like if there's something that I should be doing differently, or, changing, or some new data's come out and new research, like, learning all of that and staying up to date is part of what makes medicine medicine. We're constantly changing.
Mm-hmm. And what a awesome, view on things is always being willing to learn and grow, because I've heard the phrase that complacency kills, and when you get to a point where you think
Hmm.
that you know it all, or that you've done it all, and like all of a sudden you're thrown into a situation where it's like, oh shoot, I didn't know this. Like, had I been training, had I been preparing or trying to continually learn, maybe I would have, not had this kind of response to a scary situation where I don't know what's going on.
Hmm. Hmm. Yeah,
And
for sure. And then the other part of it is the just having the support around you, having your
mm,
mentors, having, especially on labor and delivery, like knowing your nurses and knowing, how long it takes for anesthesia to get in, and kind of just being aware of your surroundings too, I think is comforting and helpful.
mm-hmm. And then, is it important to you, like when you get off work, to also kind of not think about work and shut it out, or do you still, in your role, do you have to do stuff outside of work to kind of prepare yourself, or to think, okay, well, this person, this, it's starting to go this way, or maybe you're on the pontoon and you're with your kids and you're thinking about, okay, what happens if this happens while I'm delivering a baby, or what happens if a mom asks me this question, or you try to, like, where do you think, where's that line? Because I think a lot of people say, even for myself, like working in the jail, it's a career where I can, when I go home, I don't have to worry about it, and it's gonna, I can pick it right back up when I get there. But there is also things that I can do where it's important to dive into maybe some new laws, or how can I best assist this person in this situation. Maybe somebody comes in off the street and they're really struggling with that. It's like, well, maybe if I take some time here to prepare, I can help them. But then there's also that line of, okay, maybe I need to just focus on being present in the moment while I'm at home. Do you find that
Hmm.
that juggling battle, and what works for you?
Yeah, I think that's a topic that all physicians, struggle with kind of figuring out where that line is. And I would say for the most part, I'm pretty good at separating. I really try to be present with my kids when I'm home. Um, and I think part of that is just even with everything my mom has been going through with her breast cancer, um, like realizing that what's the most important thing to you. And so
Mm.
I've been really working on being present with my kids when I'm home and trying not to do work things. But then after they go to bed, there's definitely nights where I'm like, oh, I'm seeing this patient in clinic tomorrow, I wanted to review this and this, or I need to like refresh on this topic, or I was wondering if there's any other treatments for this that I haven't heard of, or that's new that I could offer this patient. And so there are definitely nights where I try to be present with the kids while they're awake, and then once they're in bed, looking into that stuff. And sometimes there's starts to close and different things like that, but for the most part I would say I try to keep work at work. I try to designate time for my kids and my family, and then whatever time is left to try to review things like that.
Hmm. Do you think your experience as an OB has helped make you a better mom, or do you think being a mom has helped you become a better OB? Or what are your thoughts on that?
Oh, that's an interesting question. um, I would say that probably being a mom has made me a better OB more so than being an OB has made me a better mom. So when I gave birth to my first child, Lila, I was in training and residency. It was the end of my first year that I found out I was pregnant. I ended up delivering a month early, and I had a C-section because she was breech, meaning the baby was butt down.
Mm.
And then I got severe preeclampsia, which is a high blood pressure disorder of pregnancy. Um, and so she was considered a preemie. But there was my maternity photos were the next day, so I didn't get my maternity photos.
Mm.
Um, and I had an attending picked out that I wanted to deliver me. I had, all these things kind of lined up for that, and even work too as a resident. I wasn't scheduled to be off of work quite yet, and the plans change. And I think that feeling that grief or that loss of your birth plan or how you expected things to go. um, I mean, I'm constantly telling patients that, oh, this has come up in your pregnancy, here's a complication, this is what we need to do. And just being with them in that discomfort of, this wasn't my plan, this isn't how I wanted it to go. um, and like being able to be present with them in that moment and feel that with them, I think has really been super powerful and helped me connect with patients, like having gone through that myself.
Hmm.
Um, and then my second child, Stella, she was born. I just started working at Crosby actually, and she was born 2 months into after I started, and she was born 2 months early, so
Oh wow.
like 31 weeks and 3 days. I had gotten life flighted from Crosby to the University of Minnesota. I had something called an accreta, which is where the placenta grows into the muscle layer of the uterus. Um, and I stayed in the hospital. I was there for 2 days, and then they decided that I needed to get delivered. And so, and during that delivery, because the placenta was invading my uterus, they had to remove my uterus as well.
Oh my goodness.
Um, yeah, so, obviously that wasn't in the plans.
Hmm.
So, and then the baby was in the NICU for 2 months. And so, going through all of that, and I had severe preeclampsia at
Wow.
that time too. So, kind of all of those things, when I tell a patient on labor and delivery that their blood pressures are high and explaining to them, the different classifications of preeclampsia and what that means and why it's important to, do X, Y, and Z. But at the same time, being present with them and acknowledging, like, I know this is really crappy. I know it's not what you wanted. It's not what you planned. Um, and like this is what we need to do to keep you and baby safe. And sometimes, I feel like sometimes physicians don't really get into the personal things of their lives. They keep that kind of separate. But honestly, I usually share that with moms that I'm diagnosing with preeclampsia. I've had this both of my pregnancies, or ones that I have to transfer out to have a preterm baby. And I was like, I understand, my baby was in the NICU for 2 months and we lived 2 hours away. Like it was really hard. And I'm here for you for that. So I feel like
Wow.
going through those experiences has just overall helped me connect better with patients and kind of understand, before I was a mom, when I was in training or medical school, and, the mom would be crying because she had to have a C-section and didn't want a C-section. And I was kind of like, you're alive, your baby's alive, both of you are healthy. I didn't really understand kind of what the big deal was until,
Mm.
I had to get delivered a month early via C-section, and that's not what I
I
wanted.
really appreciate you sharing that, and that was not something that I was aware of, and that's getting into your personal life and personal struggles and stuff that you've gone through. And like I said before, like that's what this podcast is all about, trying to have conversations that are relatable to other people, and that's exactly what your experiences are. It's something that moms can relate to when they're panicking and they're like, I don't know, my baby's not just going to come out in one push, and you're able to tell them, no, maybe not, but it's going to be okay, and like hold their
Hmm.
hand through it. And that, I'm getting goosebumps, is something that's extremely important to me. Because Courtney, when she, after the baby and stuff that she kind of went through with the mental side of giving birth to a baby and everything that goes on, and it was kind of a scary couple weeks for both of us because she was really having a tough time. And
Hmm.
when we met with you and started talking to you about it, you made it so like normal, and it blows my mind how it's not talked about enough. From my perspective, like we talk about depression and anxiety and stuff like that, but as far as postpartum depression and anxiety goes, I don't know
Hmm.
if moms just kind of, they don't want to talk about it or they just deal with it themselves. But bringing it up to you, when Courtney brought it up to you, like you immediately were like, oh, we can do this. I'm gonna plug you into this resource. There's this group of moms that meets up, and like all of those things. And time, you're like, give it some time. It's the first couple weeks, you'll be all right. You got this. And it was on a much more deeper level than that. You weren't just like, hey, you got it, rub some dirt on it. It was very, very important stuff. And maybe had you not gone through what you went through, maybe you wouldn't have been able to connect with moms on that level. And I'm very, very sorry that you had to have to go like through those things. But
Hmm.
it's crazy how life works it out sometimes. And I'm a believer in God, so I know that it's all part of His plan. Has an interesting way of working things out to where you have to go through something difficult and you think, why is this happening to me? And then later on you go, oh, okay, this
Hmm.
was a really difficult thing that I had to go through, and I'm able to take it and apply and present it to this mom who's scared. And maybe it won't go the same way that it went for you, and that's something that's extremely difficult too. But being able to relate to them and being able to have an OB when you're going into something that's the complete unknown of
Hmm.
pregnancy and birth and parenthood, and have somebody like you who has gone through some things like that, makes it so much more comforting to know, like, oh, she went through this and she is a rock star. Maybe I can do this. And that's an inspiration for not only myself, but I know like for Courtney too, like knowing that, okay, my OB went through these things and
Hmm.
she's happy. She continues to go into delivery rooms and deliver babies amidst the experience that she had that probably wasn't very enjoyable. Like she still does it, and she does it with a smile on her face. There aren't words to describe that. So I can't thank you enough for sharing that part of your story, because it's exactly it. It does make it relatable. Like your experience as a mom has helped you expand the possibilities of becoming an OB to the best, and past those limits. Like we talked about in the
Hmm.
beginning, like you're not just an OB, like that's what you do for a job, but you maximize it to the point where it's like, I'm not just delivering your baby, I'm going to be there to help you through the after parts of it too, whether it's physical complications, whether it's mental complications, like, and you were
Hmm.
at that group too, and you held Kaden, like you were like right in the trenches with her. So props to you for that. That's awesome.
Yeah. I mean, it's super, especially, perinatal mood disorders. It's so common, but you're right. No one talks about it. I mean, 1 in 5 women go through that. That's a lot. And it's super common. And I feel like you're right. A lot of times it's not something people talk about. I went through postpartum anxiety and depression as well. And even, and I didn't even know what it was at first either. I was just feeling so crummy after both of my deliveries really, because with Lila, my first one, I went back to work with residency. I only got 6 weeks of maternity leave,
Hmm.
and I went back working 80 plus hours a week, and I was on nights, and so I basically didn't see her for 3 weeks after I went back to work, and so,
Hmm.
I was feeling really crummy about that, and I was talking to one of my colleagues, and she's like, you know what, Alicia, like, you're like that's not normal to like feel like that, and you've lost weight, and you don't seem like you're doing well, and I was like, you know what, you're right, I'm not doing well. This sucks. It really sucks, and um, and I started seeing a therapist, and even at that time, I thought about dropping out of residency. I had made it that far. That's how bad it was. It was like I was just so down that I was missing this time with my baby, and I was so miserable. And really, there's a lot of things that contribute to postpartum anxiety and depression. Baseline mood disorders, traumatic deliveries, life, like having to go back to work at 6 weeks with after my first baby, like
Wow.
that's yeah. And there was other things, like I would try to fall asleep at night, and the first couple weeks I slept with the lights on because I was worried she was going to stop breathing, right? Like, as a physician, I know that she's just not going to stop breathing in the middle of the night, and having the lights on has nothing to do with that, right? Like, I logically I know that sleeping with the lights on is not going to prevent her from stopping breathing. But like when I would wake up and I would be able to check on her and see that she's breathing and then go back to sleep with the lights on, and logically you know that that's kind of irrational, but at the same time, it's really anxiety, like postpartum anxiety, and so many women go through it, and not a lot of people talk about it. So when
Hmm.
patients bring that up to me, I really try to normalize it first of all, because it's there's kind of some stigma around mental health things too, and it's just so common and no one talks about it. I want people to feel comfortable talking to me about it, and telling me what's going on around them and what support they have, and really making sure that they're set up for success. Because really, perinatal mood stuff can actually last for 12 months after delivery.
Wow.
So, the first 2 weeks they call the postpartum blues. So that's a lot of the hormonal fluctuations that happen after birth as well that contribute to some of those things. But, beyond 2 weeks to 12 months, that's all considered kind of a perinatal mood disorder. Um,
Hmm.
and also connecting them with resources, like you said, I feel like sometimes people are like, you know what, I would like to see a therapist, but I don't know how to go about getting a therapist, or you know, where do I go? What do I do? And so really trying to be that interconnector to get those resources and get people to where they want to be.
Hmm. It's huge, and especially when you're, like I said, right there with them. It's almost like I think of, like, I'm a big football fan, so like it's like, hey, yeah, you should come play on this team. It's really cool. And then they go to like go play, and you're right there with them, suiting up, like, okay, let's go. Like it's so cool. It's just that community, like coming together and helping each other out. Like, we can't do this life alone. And
Right?
I think of, like, I can't remember the analogy, but there's like trees somewhere, like they're really big trees that are standing alone, and those ones are going to fall over. But the more you get close to the roots intertwine underneath, and they hold each other up. So it's like,
Mm,
why go do it by your own? Why get blown over by the wind and different things that life throws your way when you could be around other people and interconnect your roots and help other people too? Because, like, yeah, you brought this group to Courtney's attention. She went, you were there, you made it a great experience for her, and she's now inviting other moms that she knows in her life and is able to be a
yeah.
resource for them. So not only are you helping Courtney, you're helping Courtney and, mom A and B and C, and then those moms are going to help the, like, it's just, it's a
Yeah.
big, just intertwined tangle of roots that are helping
Yeah.
each other.
It takes a village.
Now we kind of talked about, the downs and stuff of deliveries and birth and everything, all the maybe the difficult things. With your permission, I got the go ahead to record the last, like, 20 minutes of the delivery, and I'm really glad that I did. I know we started out pretty soon, and I was like, all right, I'm gonna set it up, and you're like, we may have a little bit to go, slow down. And but like 25 minutes of video, and it caught like the part where you kind of had to talk to Courtney. She hasn't watched it yet. She's like, I'm not ready yet, but I want to watch it soon. And I've gone back and kind of picked it apart a little bit. But there was a point, yeah, where Courtney was pushing for so long and really just giving her all, and you had to say, okay, well, we may have to transition. He's not coming out. These are some options. And like at one point, I went down on my knees, and like I started just praying my heart out, and I was like, I could see how scared Courtney was, to have to
Mhm.
maybe go in to get a C-section, and like after all that work, like she just didn't want to be defeated in her own mind. And moving on to the next part, like, and I didn't think I was gonna watch either. Like going into it, I had no plans on watching anything going on. Like I wanted to just be there with Courtney, but like I found myself like cheering everybody on at one point because it's like he just wouldn't come out. He kept he'd go to one spot and then he'd go back in. And there was one part when he was there and then he pushed past the part where he was kind of stuck. And that's when I knew. I was like, I'm getting goosebumps. We're going to have this baby. He's going to come out. We don't have to go get a C-section. And I don't know if maybe you had thought that as well. I'm sure you did. I
Yeah.
start crying and Courtney's like, stop crying. But she didn't realize that he's coming out. Like she can't see what I see. So she's like,
Right.
you're making me sad. Like I can't do this. And then all of a sudden, the next one, he comes flying out and everybody's just, I lost it. I didn't know if I was going to cry. I didn't know what to expect going into it. And I don't think I've cried harder out of joy in my entire life. And
Mhm.
being there with Courtney and holding the baby. And I noticed you in the background. You look at us for a second and you tear up. You look like you're getting emotional with
Yeah.
it. Do you find yourself getting invested in those moments like quite often? Or is that just, part of the moment, or what do you feel in those moments, like because it's like we said, it's an emotional weight to have to carry to bring somebody into the world not knowing maybe what's going to happen, maybe it's going to go perfect, maybe it's not. Is that
Mhm.
like relief, or do you just find yourself intertwined in this new family's story? But what are your thoughts on that?
It's so the birth is so intimate, right? Like this is gonna affect your life. It's gonna affect Courtney's life. It's gonna affect you. Like you're walking into the hospital as a couple or a family, but you're walking out with one more person, right? It's
Hmm.
something that is so big that you can't even really wrap your head around it, right? And so I do think that there are definitely some births that I'm more affected by than others, and I think part of that is that longitudinal relationship. I saw Courtney for most of her pregnancy, so I did feel like personally connected and invested in her, and I don't have that with every patient, honestly. Some patients I see, one time throughout the pregnancy or two times, and we meet in passing, and I give them great care as well, but it's I don't have that emotional attachment. So I definitely have, a handful of patients that I really feel emotionally invested in. At some point in my career, is that going to become, too much for me and overwhelming? Maybe. But I feel like right now that I need that joy, like
Hmm.
that's and sadness too. Like there's some deliveries that, I've had those connections with patients that don't have great outcomes, and
Hmm.
there's definitely been times where I've sat in a room with a mom and a dad and I just cried with them,
Hmm.
like, and it's therapeutic for me and probably for them just to be with them in that moment. But the highs are so high, but the lows are also so low. Um, but I really do feel like um, yeah, and the more deliveries you do, you kind of lose some of that emotional emotional piece of it. But then it's like you have delivery, like your guys' delivery. Like I haven't teared up in a delivery in in probably like a year, like, but it's just the connection that you have with people, and then once the baby comes and you just feel all of this emotion in the room, it's palpable, right? Like Courtney, you, Kaden, like it was just like, oh my gosh, I'm just so blessed to be here for this special moment and so privileged to like be able to be part of this that it just kind of gets. Now I'm getting goosebumps. It gets overwhelming.
Even if you wanted me to forget you, I there's to the day I die, I will never forget that moment. Like that was, again, like you said, we've had the highest highs and the lowest lows going through our lives individually, but like for our paths to meet in that moment, and for Courtney to be pushing so hard and fighting so hard, and seeing her almost defeated by reality of maybe having to move on to C-section,
Mm-hmm.
and then being able to, and I think you said like, okay, we'll give it two more contractions, and so we're like, oh, I was just you could feel the defeat in the room. And
Mm-hmm.
for you to just like give her that chance of, okay, we're gonna give it a couple more, and then for it to just work out the way that I was praying and the way that we all were hoping, it was just like yes,
Yes,
the
I
best
know, and
comeback
there's
story ever. And uh
and that moment you're talking about is, I remember that moment too, because there was a point where he kind of got past that point that he was stuck at, and at that moment when I was like, yes, like thank you, and this is gonna work. I remember I know the exact moment you're talking about. I remember it vividly.
And we can just wrap it up with this. In your experiences, whether it's more some of the personal ones that you spoke of, or whether it's you know becoming a parent and trying to figure out, okay, how do we prepare to be parents, or how do we prepare to for delivery, and then after the fact, dealing with these different things. And this may be a longer question, so answer it how you would like to. But what advice would you give, to people that may be a little nervous for it? Obviously, you think regardless you're going to be nervous for it, but
Hmm.
what is some advice that you could leave us with for new parents, or people that may be experiencing the highest highs and lowest lows of pregnancy and birth and parenthood?
Yeah, that's a very big question. I would say that, I mean, we kind of already talked about this, but it takes a village. So,
Hmm.
really reach out to your family, your friends, your support people. Ask the questions. Ask anything. Nothing is too scary to talk about. Like if you're wondering, like, what if this happens? What if that happens? Ask. So because sometimes just hearing, oh, if that happened, it would actually be okay. Kind of those conversations with your provider, and to really advocate for yourself and your family and your baby, and ask the questions, ask for what you want for at delivery timing. um, know that you're not alone. Everyone um, that goes through pregnancy and childbirth probably has some sliver of similarities to your story, right? um, and so, knowing that you're not alone. I think social media can be really hard on new parents. um, and it's hard because especially if you're breastfeeding and you're waking up in the middle of the night to feed the baby and all these things, you have all this time and you're like, okay, I'm just gonna sit here and breastfeed and scroll on my phone, and you see all these influencers and things that seem like, oh, this mom has it all together, it's perfect, it's great, she has all this, like a clean home, her baby looks happy, like all these things. But kind of taking that with a grain of salt and knowing that that's probably not reality, right? There's probably a mess in the background that you just can't see on the phone.
Right.
So giving yourself a little grace, and
Hmm.
the only thing that your baby needs is you,
Hmm.
right? They just need you. They need your love, and whatever else happens, and you do your best, and that's all we can do.
Love that. That's
Yeah.
perfect stuff right there. Thank you so much for that, and thank you so much for taking the time again to be on here and sharing your story. I Again, like I said at the beginning, even if nobody else listens to this, I enjoy talking with you. I enjoy talking with people who take life to a different level and want to help other people. It's so inspiring, and it really fills my cup. So thank you so much for your time, and thank you for being you and continuing to do what you do, because all the hard work, all the stuff that you went through, to make you into who you are today has influenced. I could. I don't want to speak for Courtney, but based off of you guys' relationship, like it's influenced her for the better, and it's made an impact on my life for the better, and my son. So I just want to say thank you for that, and I appreciate you, and look forward to meeting with you again in the future.
Sounds good. Thanks so much, Bailey.